My name is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. And I'm going to discuss ketamine for treatment-resistant depression and ketamine therapy for adolescents and what some of the latest data is regarding that. So ketamine has found some efficacy for adolescent depression. And the question is, how efficacious is ketamine therapy in this population? And we know that ketamine has been effective for treatment-resistant depression in adults and suicidality and bipolar depression. And there hasn't been a whole lot of studies in the adolescent population, although clinically we've been using ketamine infusions for patients in the ages of 15 to 18 for some time now, even in our center, and found great efficacy in patients who are appropriately selected. So, a study in 2021 that was in the American Journal of Psychiatry by Jennifer Dwyer and colleagues randomized a group of patients for treatment resistant depression therapy with a single infusion of ketamine. The placebo that they used was midazolam. And effectively, what they found was after that single infusion of ketamine, that the drop in depression scores was rapid with the ketamine. In the first day, effects were seen, and it was maintained over the course of 14 days. And you can see that on the green curve in this particular graph here. Whereas in the midazolam group, which is Versed, which is a benzodiazepine, you could see a drop that goes down somewhat around day 2, but the curve climbs right back up to the basic depression scores that they started with. And so, effectively, in this randomized placebo controlled clinical trial of adolescents, they found that the ketamine was well tolerated and had short term effect, at least 2 weeks, in reducing depression compared with the placebo. And the choice of Versed in this case was because it gives a similar feeling to ketamine in some way. You can sense that you've received something. But effectively, though, in these patients, it was determined that there was a clear separation of the curves, meaning that the ketamine truly worked and the placebo effect went away. And so the basics of this trial again was 17 patients that were selected between the ages of 13 to 17. And it was a 4-week crossover trial. And most of these patients had failed at least 3 to 3.4 treatments, and they were depressed for at least 21 months. In these individuals, they were giving a standard dose of 0.5 milligrams per kilogram of ketamine over 40 minutes versus Versed at a dose of 0.045 milligrams per kilogram over 45 minutes. And effectively, what they found was that the single infusion of ketamine basically lowered the depression scores based on a clinically validated scoring system, which is the MADRS score. That this score actually dropped from 30 to 15 in the ketamine group, and 76% of the adolescents got response of a 50% reduction of that score within 3 days versus only 35% of the placebo patients. So response is considered to be a 50% reduction in depression scoring, and 76% of these adolescents had response and had failed at least 3 to 3.5 other treatments prior to this point in time. And what was interesting is that the ketamine group separated out from the midazolam group for almost 2 weeks. You could see the curves were completely parallel, whereas in adult studies, generally by 7 to 10 days, you start to see the response lessen with ketamine. So how exactly does ketamine help depression? Well, this is a synapse here, and you can see at the top that there are 2 neurons present there, and that you can see effectively where the little box is, that is a connection, that is a synapse. And the end of the left neuron here is what you call the axon, and the dendrites are where the information is received and connected to. And down below here is a synapse. And the impulse, the electrical impulse, comes from the left to the right in this particular case, and you can see how it then travels down and causes the release of neurotransmitters into the synapse. And from there, it activates the postsynaptic neuron, and that's how information flows. Now, what we find is that basically dendritic spines, which are present in the dendrites, which is the receiving end of a neuron, are abundant and plentiful in a normal brain without any depression. And basically, synapses form with dendritic spines. That's how connections are formed. And the more spines you have, the more functional you are, the better your cognition, the better your memory and emotional regulation. The problem is stress and medical conditions and things such as elevated ACEs score, which are things like physical abuse, sexual abuse, emotional abuse, and medical conditions and genetics. All kind of come together to basically affect an individual's stress and their response to stress. And you can see that from the left side, where you have a normal dendrite with normal spines, you actually have a loss of those dendritic spines on the right due to stress. And that's where depression kind of evolves from, because there's less connectivity as a result of that, and loss of synapses, and actually a loss of neurocircuitry and even brain matter. You can actually see on functional MRIs and MRIs where there's loss of gray matter in key areas of the brain involved with processing information and thinking and sense of reward and motivation. So this kind of has downwind effects. And what has been found is that basically we have chronic stress resulting in a loss of dendrites, but ketamine can reverse this. So on the left, you can see basically a normal dendrite. This is under electron microscopy, but with chronic stress, you lose dendrites. You lose these little knobby structures, and this stress can result from pretty much anything that confronts us. Now, ketamine can allow the regrowth of these dendrites within hours. So ketamine allows the production of this glutamate burst that allows for the production of proteins inside the neuron that then produce scaffolding proteins to produce these knobby dendrites where new connections form. So what is the scope of depression? Well, basically in the pediatric arena, we have a prevalence of around 3.5 to 8%, with almost 20% of adolescents effectively being affected by depression. And there's a lot of complications from depression, which include suicide and loss of cognition and poor school performance, unplanned pregnancies, substance abuse, and physical illness. What people don't recognize, especially in the older population, is that depression is associated with increased risk of heart attacks and stroke and diabetes due to changes in insulin cycling and a number of other metabolic parameters. Suicide is the second leading cause of death in the age group of 15 to 24. 1 in 5 adolescent patients do not improve sufficiently with multiple rounds of medication. They have treatment resistance. And of the people that respond, 1 in 4 actually relapse back to depression within a year. So depression is neurodegenerative and it needs aggressive treatment. So why use ketamine? Well, the glutamate system is an important mediator in the experience of depression, and ketamine is a glutamatergic modulator. Glutamate is the major neurotransmitter in the cerebral cortex. It is a neurotransmitter of learning. It's an excitotoxic neurotransmitter that, again, composes the majority of our neurotransmitter load. And it basically sculpts the tone of serotonin and dopamine, which are the molecules of happiness and reward. And we sense that and think about serotonin and dopamine as being critical players, but effectively they do allow us to be happy and motivated and rewarded. But the issue is that their tone is really sculpted by glutamate, which basically controls things from a top-down fashion. And ketamine has shown basically rapid antidepressant effects in adults who are treated with it, with somewhere of an odds ratio of 9.87, meaning that there's a 9 to 1 chance or 10 to 1 chance effectively that an adult is going to respond in 24 hours after treatment with ketamine. Ketamine has been found to be effective in adult bipolar depression and suicidality, and it has an excellent safety profile in terms of both its cardiovascular risk and also its low ability to affect breathing and respiratory status when it's being used at low doses for ketamine infusions. There is some evidence as well of efficacy in prior open label ketamine trials in adolescents, and here's one listed from 2018 from Cullen's group, in which they studied in an open label fashion IV ketamine for adolescents, and they showed efficacy as well in that particular study. So we should really be considering ketamine therapy aggressively in adolescents and in adults as well, because it is rapid acting, but it is a treatment, not a cure. Again, depression after you've had multiple bouts, especially, continues to get worse and it will recur more and more frequently, causing, of course, loss of fulfillment and loss of cognition and loss of a lot of different quality of life indicators. Ketamine has a robust efficacy in anhedonia as well, which is a common substrate of depression in the adolescent depression spectrum. So anhedonia is basically a loss of pleasure. You just don't feel great about the next great adventure. You just don't feel hopeful. You don't necessarily cry or feel sad. You just don't exist. You just kind of feel numb to the world. And that's a common construct in the pediatric depression experience. And unfortunately, there are very few treatments for that. And ketamine happens to be one of the most significant medications that can actually improve anhedonia. The other thing is that the traditional SSRIs may have an association with increased suicidality in the pediatric and adolescent arena. So we need to explore new treatment options, and ketamine certainly is one of those.